Back when I was 14, I was involved in an ATV accident where I ran into a telephone pole on a four-wheeler head first, going 35 miles an hour. So naturally, I broke every bone in my face from my eyebrows down and lost a bunch of teeth and ended up in a coma for about 5 days. I had my jaws wired shut for 2 months. And my teeth were broken, missing, misplaced, kind of decaying and rotting. And I survived off of ice cream, pudding, jello, milkshakes, all the things that you should never eat anyway. That's what I was surviving off of while my jaws were wired shut. And so my liver enzyme spiked and my kidneys started shutting down as I became malnourished and emaciated. When they took my wires off, I couldn't open my mouth. My jaw was completely fused shut. It took 9 surgeries over 4 years for me to be able to open my mouth wide enough to get a dental drill in there to start fixing some of my dental disease that had developed over time.
This is StRest. I'm Kerstin Lindquist, health coach, author, and Emmy award-winning TV host. I've committed to helping people reduce stress through impressive health science, attainable mindset change, and biblical truth. Let's have a real conversation with zero judgment and endless solutions that you can use. You aren't alone. You can do this. Let me help you reduce stress and make room for rest.
I kind of went down this rabbit hole after having some of our other guests talk about things like Lyme disease and mold and how what happened in their mouth actually influenced what was going on in their body, and how once they fixed that, they felt so much better and all of these chronic diseases were starting to rectify themselves. And so that's when I found Katie Lee. She is a dentist, Katie Lee DDS. Dr. Lee is not only a dentist, a dental surgeon, she's also an integrative and functional medicine practitioner who really in her clinic brings everything together. So when you go in there, they're going to scan you from top to bottom and look at everything that's going on. We have a specific conversation in this episode of StRest about how what's going on in your oral microbiome could be leading to the fact that you cannot get or stay pregnant. This is one of those episodes where she says something and you see the lights go off in my head, because I am that person who didn't know I had endometriosis, didn't understand why I was miscarrying, was given this diagnosis of unexplained infertility. And could it have been as simple as a swab in my mouth and a test that let me know whether or not I had different bacteria that could be causing these problems? Then we take it into women in middle age, that dry mouth that you're experiencing, and why that's a problem and could be a problem down the line for not only a myriad of health issues, but also cognitive health. And we talk about the 2 pathogens that can be found in your saliva that could be a precursor to dementia. Did we ever get any of this information from our dentists? We didn't until now. Let's welcome in the author of Saved by the Mouth, Dr. Katie Lee. Dr. Katie Lee, thank you so much for being here with us. Can you tell everybody what it is that you do?
Yes. So I am an integrative and biological dentist, and my office is based out of Centennial, Colorado.
What got you into biological dentistry?
Yeah. So I've had a long career. I've been practicing since 2010. And it's been a slow transition into biological dentistry, but it's really where I think I was meant to start. It's just such a nuanced little niche, and you're really not trained that way when you go to dental school. Back when I was 14, I was involved in an ATV accident where I ran into a telephone pole on a four-wheeler head first, going 35 miles an hour. So naturally, I broke every bone in my face from my eyebrows down and lost a bunch of teeth and ended up in a coma for about 5 days. I had my jaws wired shut for 2 months. And my teeth were broken, missing, misplaced, kind of decaying and rotting. And I survived off of ice cream, pudding, jello, milkshakes, all the things that you should never eat anyway. But that's what I was surviving off of while my jaws were wired shut. And so my liver enzyme spiked and my kidneys started shutting down as I became malnourished and emaciated. And so I learned at a young age just how much your mouth affects your overall health. And then when they took my wires off, I couldn't open my mouth. My jaw was completely fused shut. So it took 9 surgeries over 4 years for me to be able to open my mouth wide enough to get a dental drill in there to start fixing some of my dental disease that had developed over time. And then that and being, going to high school as a teenage girl, not having front teeth, right? That does a huge toll on your confidence and your mental health, emotional health. And so I really got to see at a young age all aspects of overall health and wellness and how it's tied to oral health. So that got me into dentistry. And then the more and more that I was practicing, I started noticing very common themes of patients that would come in that had systemic conditions going on or systemic diseases, also had a lot of disease going on in their mouth. And when we got their mouth healthy, I noticed that their systemic diseases improved or went away. But I had a really difficult time trying to get patients to go find providers to get checked out for things or to get blood work or hormones tested, because the healthcare system is very siloed. And so I had very limited, my results were pretty limited because I could only work on this, right? And so I decided to open up a clinic where we're truly integrative. So we have functional medicine providers that work at our office to help patients with underlying medical conditions, nutrition, hormones, all the things. And then I take care of the dental part, and we practice in a very biological or holistic manner.
We've had a biological dentist on before, but everybody was very, very interested, and there's just so much to talk about within it. And I think I want to be very specific here for women. For women in midlife or for women who are going through infertility, because that's a lot of who's listening to this podcast. So how does what you do and what's going on in the mouth impact those two times of our lives as women?
Yeah, I'm actually really passionate about this because I was a fertility patient for 6 years. And so I've been through the gamut or the ringer of everything that you have to go through when you have infertility issues. And I realize how myopic the treatments can be when you're working with a fertility doctor and how unsuccessful. I mean, they're horrendously unsuccessful at what they do. And my treatment was as well. Um, and then, once you get past producing babies, baby making age, right? I feel like women are just kind of left out to pasture after that, and we're really not cared for. And so I'm really passionate about women's health. We have a whole segment of my office that deals with women's health. But what a lot of people don't realize is that the oral microbiome directly affects fertility in men and women. And it also affects how gracefully or how easily someone can age and some of their perimenopause and menopausal symptoms. So we test for inflammatory biomarkers in my office. We test for salivary microbiome. We'll also test for underlying kind of hidden infections. That way we can try and rid the inflammatory burden on the patient so that way they can start feeling a lot better.
It's the one time as women, I think, that we hear about our mouth is when we're trying to get pregnant or are pregnant. Oftentimes a doctor will say on the side note, oh, your gums impact the baby. But that's it. That's kind of where it stops.
Mhm. I feel like that's kind of where the knowledge stops too. I'm really happy to hear that in your experience, people have been or at least had the conversation about the dentist and the gums while they're pregnant, because most of the time I'm hearing that conversation is not even happening. But yeah, there's very specific bacteria in the mouth that directly relate to fertility in women in terms of their ability to even ovulate. They are present. One of the bacteria is present in 64% of endometriosis cases. Um, Certain bacteria will increase infertility by 3 times in women. And so it affects women all along their journey of fertility in terms of trying to get pregnant with ovulation. It affects implantation. And then it even affects conditions that women get during pregnancy, such as preeclampsia and gestational diabetes. But then it also can lead to preterm labor and low birth weight babies. So all along the way, oral bacteria have a direct impact on female fertility.
Stay with us. There's so much more to come.
I'm super into the research right now when it comes to creatine and collagen. In fact, let's talk creatine for a second. And the one that I trust happens to be Ancient Nutrition. Research shows that women naturally have 70 to 80% lower creatine stores than men, which means we're ideal candidates for it. And collagen we know is important not only as a protein, but it's also great for joint health. And I've been feeling the joints a little bit more. I'm in my 40s. I have that cold shoulder women's 40 thing that there's a lot of different things we can do, but it's really important to pump up your collagen collagen. So I'm doing the two together, collagen and creatine, and there's actually a new product from Ancient Nutrition that puts the two of those together. Creatine is one of the most clinically studied supplements, and it's a game changer for women's wellness. It supports cognitive health. That's what I love the most about it. Muscle endurance and recovery, and it helps you build long, lean muscles and strength while staying sharp. And then you pair that with clinically studied collagen, which is what we get from all of our Ancient Nutrition products. And that can help you improve your joint comfort, your mobility, and your recovery. I take it right after a workout in the morning, and I still also love multi-collagen proteins and those peptides in my coffee every morning as well. So support your brain and your body and your beauty every single day with Ancient Nutrition, so you can look toned, you can feel strong, and you can stay sharp. Here's what you do. You go over to ancientnutrition.com and put in the code StRest20. That's STREST20, StRest20 at checkout, and you'll get 20% off site-wide. Get your collagen, get your creatine, get your Ancient Nutrition. If you are somebody who is trying to get pregnant, is going through infertility, is going through miscarriage, is there a test that you can take so you know if you've got some of this bacteria or something's going on?
Yeah, 100%. So, just like you can get your gut tested. So a lot of people will do a stool test to test for the microbiome in the gut. You can do a saliva test to check for the oral microbiome. And this is really critical because I work with patients all over the country now that have been infertile or given the diagnosis of unexplained infertility, meaning things are going on and no doctor can actually figure out what's going on with them. And then we actually test their saliva and we find out that they have pathogens that are directly linked to difficulty with ovulation or difficulty with implantation or increased risk of miscarriage. So it's very, very common that I'll have someone say, I keep having recurrent miscarriages and we can't figure it out. So then we test the saliva and oftentimes they'll have an infection with a bacteria called Fusobacterium nucleatum.
Okay, this seems like a travesty that it's not talked about more.
Travesty. Yes. So I've been shouting it from the rooftops, just to try and get like every reproductive endocrinologist out there at least testing their patients because
At least test.
just test for it. It's a very inexpensive test. You can get it over the counter through Bristle Health, or you can get it through certain dentists if they do it. And the results are there. And then once the results are there, the treatments are actually really inexpensive and not painful. So it's something simple that you can do to improve your chances of having a baby, healthy baby.
I mean, I went through it for many, many years. That's my story as well. And twice had one healthy baby that I conceived and carried to term, adopted twice, because the second time around that we tried, more miscarriages, more problems, and adopted again. And nobody ever mentioned that there could be anything linked to pathogens or something that's going on in my oral microbiome.
Yeah, we hear that all the time. And, like I said, I went through it as well. I'm sorry for your losses and your struggles. I went through 6 rounds of IVF and
Wow.
was checking out fine. And the doctors, after the miscarriage or the failed implantation, they'd be like, okay, next cycle, we're going to start again. But nothing ever changed. And I remember just saying, like, let's just take a step back. And so we paused and I ended up doing diagnostics on myself as a dentist. And this is where I really started to get into this stuff. And I found out that I had a root canal that had failed and I had an abscess in my jawbone that I had no idea I had because I had no symptoms. And so obviously I got that treated right away. But yeah, the doctors, they don't even check for anything else, right? Like they have such a myopic view of what they're working on. And if it's not in the uterus or the fallopian tubes, it's not part of their treatment plan.
And we've had an infertility expert on talking about unexplained infertility, because that's actually what I had, was unexplained infertility. And her point is that's not true.
Right.
Unexplained infertility is the doctors don't know. Well, you need to keep digging because there's something that is preventing you from getting pregnant or staying pregnant.
We're put on this earth to reproduce, right? Like that's part of our biology. So if that's not happening, that's a fundamental thing to survival of the species. So if something's not happening or if that's not happening, something is wrong. But you're right, they just don't know. And what's really cool about oral health is it's something that you can do really easily. You can turn over that rock, kind of explore underneath. And the best case scenario, nothing's wrong with your oral health and everything's great. But because there's so many diseases, there's over 57 systemic diseases directly tied to the oral microbiome and to things going on in the mouth. So even if it's not directly affecting your fertility, if you do fix whatever's going on in their mouth, you're going to be healthier overall anyway. So it's just something that people can do that's easy, relatively painless, and relatively affordable.
So, what is your recommendation if you have a woman of childbearing years who either is going through infertility treatments or is having a hard time getting pregnant, or maybe she isn't? Maybe she's just thinking of getting pregnant. What do you
Yeah.
say? What should she do?
So immediately order a saliva test. You can do it through Bristle Health online. You can contact me on my website, which is katieleedds.com. You can order a test there. But it's really critical that you get tested because time and time again, I'll have patients that come to my practice that are seemingly healthy. They say they don't have a whole lot of, they have zero systemic diagnosis. We'll say that. They might have some vague symptoms that don't meet Western criteria for a systemic disease diagnosis. And they'll say, I go to my dentist every 6 months. They tell me everything is fine. My gums don't bleed. And then we test their microbiome and it is a wreck. And what we know about disease is that disease takes about 10 years of dis-ease in the body, right? That's where the word disease comes from, and 10 years of chronic inflammation in a certain organ system before you reach the tipping point of that Western medicine diagnosis for a condition. So that's really nice to know because there's a long time period there that you can go in and affect what's happening in your body and reverse those disease processes. So I love when I get patients before they get diagnosed with a systemic disease because I can usually fix that and reduce the inflammatory burden that's coming from the mouth that hurts the body.
You said in your experience, you had a root canal, you had an abscess, and you had no symptoms.
No symptoms.
That's the other thing that I hear when I'm working with clients. And I suggest perhaps we start to look into their mouth, whether it's old fillings, whether it's root canals, whether it's wisdom teeth that were removed, and see if there's anything that's causing a problem there. I hear, but I'm fine. I don't, my dentist says I'm fine. My teeth are fine.
Yes. Yeah, we see this a lot. Even with, I would say, with gum health, which is plays a role in salivary microbiome testing. I think that's probably the most underdiagnosed condition is actually periodontal disease or gingivitis by dentists. We are grossly underdiagnosing it. We are grossly undertreating it. And it's because we're waiting for disease to happen. We're waiting to see bone loss on an x-ray. We're waiting to see recession on an x-ray before we give the diagnosis and render treatment. But at that time, it's too late. Now we're just chasing our tail, trying to keep it from getting worse. But the pathogens are already getting into the body at that point. And so same with, fillings and root canals and wisdom teeth, that leave cavitations or things like that. Um, there's advanced diagnostics that we have in dentistry now, such as a 3D cone beam CT scan. That's what I took on myself. That allowed me to see the abscess because traditional 2D x-rays don't show it. So I have no idea how long that abscess was there. Um, because I was taking 2D x-rays and didn't see anything. It wasn't until I took my 3D scan that I noticed it. But we know root canals are very dangerous to our health in terms of cancer risk and heart attack and stroke risk, and fertility as well. And then, we can get into the whole conversation of toxic fillings and cavitations and things like that. But it's all really damaging to our health. And the mouth is the opening to the body. So if the mouth is not healthy, everything going in is not going to be healthy either.
The cone beam scan, is that one they put in your mouth or do you stand up and it goes around you?
So you stand up and it goes around you, but there's two different versions of that. One is a panoramic, which is still a 2D x-ray. So it's 2D of your entire jaw. But then you have the 3D cone beam, which is same. It goes around your head, but it shows three-dimensional around your teeth and your jaws. So it's much more detailed.
If you have root canals, what do you do?
That is the age-old question. I was just on a conference call this morning with some people talking about this and giving opinions. It's difficult because, especially in the biologic community, some people believe you should absolutely never have a root canal because that tooth is now dead. It doesn't have a blood supply. And therefore, when you don't have a blood supply, you have no immune system. So our teeth are organs, and each tooth has a blood supply. And that's how the teeth are able to stay in our mouth. Because if you think about how much bacteria and acid and viruses and fungus are in our mouth, it's a miracle that we even have teeth. And it's because of our blood supply. So when you cut that off, the tooth has no way to defend itself anymore. And so any pathogens that are there or develop can really flourish. And the dangerous part about root canal treatments is that when you kill the tooth off and you cut out the blood supply, you're also taking out the nerve. So you don't get any warning signs that something is wrong. Just like in my case where I had the abscess and I had no idea. The warning sign is off. So what I tell people is, um, I try and give them all the information and let them make the best decision for themselves. So by the time that we get to needing a root canal treatment, there really is no good option at that point, because option one is we do a root canal. And nowadays we have much better technology than we used to. We can use advanced irrigation techniques such as like ultrasonic irrigation. We have ozone that is very effective at killing bacteria, even MRSA on contact. We have lasers that can effectively sterilize the inside of the tooth. And then we can use biocompatible filling materials to seal it up. But the key is because that tooth is dead and because there's no warning or signal there, you must scan that tooth every 1 to 3 years to make sure an abscess isn't developing or isn't there. And that's where the miss typically is that these teeth are not monitored properly to see if something is going on. Now, the alternative is, let's say someone doesn't want to have a root canal or they want to take them all out. Okay, well, now we need to replace the teeth. So now we're talking about putting foreign bodies into the jawbone to replace missing teeth, or we're talking about hooking teeth together. And so now we're drilling down healthy teeth. So once you get to the option of needing root canal treatment, there really isn't a good one. I just try and educate the patients of pros and cons and let them decide. But if they have, to answer your question in a long-winded form, if they already have root canals, I would absolutely get a 3D scan to see if there is an infection there. If there's an infection there, then treatment must be rendered, whether they get that retreated by a biological endodontist, or they take it out and get an implant or a bridge.
So what are we talking here? Do you think will insurance cover you get like if I walk in and say I've got root canals, I want you to scan me? Am I paying out of pocket for that?
So uh that's difficult to answer. Number one, most biological dentists don't take insurance.
I know that. And just so we're clear, I am very pro. We should be going to biological dentists anyway. It's the same thing with functional doctors, friends. What I'm saying over and over again is, and I think it's where healthcare is moving anyway. You can only really rely on your insurance for catastrophic things.
Yes, we're really good at emergent care, right?
Yeah, emergent care, right?
Yeah.
And if you want to be proactive and you want to work on longevity and you want to be healthy, which I know since you're listening to this podcast, you do, you're going to have to come to terms with the fact that you're going to start going out of pocket for this and you're worth it to do that. So to get that out of the way for sure. But I think a lot of people, it's even another step to be like, oh, but even the dentist I have to pay for.
Mm-hmm. And I would say, honestly, I'd say like the dentist is the most critical to pay for it. Now, caveat, I do take insurance and I'm a biological dentist. I think I'm the only one in the state of Colorado that does. So my scans are free for patients. And some offices may offer free CBCT scans for their patients, or they include that in their new patient exam price. So, I'd encourage people just to call and ask the office. But to your point, it is super critical because I'm a patient where I had a root canal. I was taking 2D x-rays. I had no symptoms. And it wasn't until I did that 3D scan that I noticed I had, and it was a major abscess. It wasn't a small one, but you couldn't see it on 2D. And the amount of damage that chronic infection is doing to your body is going to cost you 100x of what that $300 scan is going to cost you. So you are absolutely worth it to pay the $300 or whatever they charge to get that scan done, because you're going to pay 100x that to fix your health if you leave it there too long.
And what I hear you saying is if you do have root canals and you do a scan and it's fine, you should probably be getting them checked though every year to 3 years.
Yes. So I've had some people, like, for example, my root canals were done back in the 90s. So it was done when I, busted my face and lost all my teeth. So the chances of my root canals, being reinfected or having mold or some toxins growing in there at this point is probably really high. And so if someone has an old root canal and if they're having systemic health problems, but I'm not seeing any signs of infection on the scan, I will still send them to a biological endodontist just to have that tooth cleaned out again. Because there's no way, after 20 years that tooth's going to be still completely clean. But there's some patients that have really robust immune systems and can tolerate root canals just fine. And then I see other patients that come in and they have 4 or 5 root canals and all of them are abscessed. So in that patient, I would never recommend them to have their root canals or keep them because, I mean, proof is in the pudding, right? Like their body just can't tolerate it. And so you really have to look at case by case basis when the patients come in of their overall health, their overall inflammatory burden, and then how well do they take care of themselves? If they're not eating a very nutritious diet and they're low in supplements and minerals and vitamins and nutrients, they're not going to heal from a root canal. So it's case by case basis.
Forgive my ignorance here. When you said you can take the root canal off, you have to do this, this, this. Is there situations where you can take out the tooth and just not have a tooth there?
Great question. And I'm actually really glad that you asked that. In my opinion, I would say very few, less than 10%. If you lose your first molar tooth, you are losing over 50% of your chewing capacity just by missing your first molar. If you lose your second molar and your first molar is still there, you're losing about 35% of your chewing capacity. Now, the way that affects everything else is our teeth work in pairs. So if you take out one tooth, the other tooth is going to keep erupting because it doesn't have anything to stop and to push against. The teeth behind it or around it will start shifting. You lose your jawbone. We never want to lose bone. And then the teeth on either side have to start doing more work. They're taking more load that they are not meant to take. And so I'll see teeth all around the space where we're missing a tooth break down very rapidly. I also see patients move, and I was this patient because I lost a tooth, right? While I was waiting for my implant. You start chewing on the opposite side of your mouth solely because when you're missing teeth, unless you chew your food properly, it's now affecting your digestion because you're swallowing bigger and bigger boluses of food. So I'll see patients develop digestive issues, acid reflux. Just had a patient in here yesterday. Was it? Oh, Monday. We took out a tooth. She had an abscess, so we took her tooth out, and now her left TMJ is bothering her. And she's like, "What's going on?" And I'm like, "Well, we've shifted the power, now you're only chewing on one side. So that jaw's starting to hurt. Now we're going to replace her tooth and she'll be okay. But you don't want to disrupt the ecosystem. So you should always, in almost all cases, replace your tooth.
You said if you're having systemic issues, so what might those issues be when you actually are showing symptoms of any problem like an abscess or mold or anything like that that's happening in your mouth that you didn't know about?
So sometimes patients won't have any symptoms going on in their mouth that can elude them that something's wrong. But in terms of systemically, what we see and what we know is that the main cause of all systemic disease is actually inflammation. And so when inflammation shows up in the body, it can look like heart disease. It can look like chronic pain. That's a big one. If someone comes in and like they're achy, they're swollen, they're puffy, that's a sign that the body is on fire. Also, if their joints hurt. And so one place we want to look for the root cause of that inflammation is going to be in the mouth. Women who have fibromyalgia or anyone that has rheumatoid arthritis, that's a big one that's tied to the mouth. Diabetes is systemic chronic inflammation of the vascular system. That's related to the mouth. We'll see that. Acid reflux is another one. So any kind of inflammatory disease symptoms that someone would have or just vague symptoms could be coming from the mouth. Also digestion, that's another big one. So when people come in with gut issues, saying they have constipation, gas, bloating, diarrhea, anything associated with that, oftentimes is a microbiome disturbance of the mouth that is ending up in the gut because people are really focused on gut microbiome, which they should be. But you got to stop and think, how did the bacteria get to the gut? Comes through the mouth. So there's about a 45 to 50% overlap between the oral microbiome and the gut microbiome. And so you can't have a healthy gut without a healthy mouth.
Gosh, wouldn't it be great when we get to that day? And I say when, because God willing, we will. When you go in and your labs or your doctor is pointing towards type 2 diabetes and they check your mouth. where they check everything as opposed to just putting a Band-Aid and putting a drug on it.
Yes. That's what we're trying to build at my center. So, we, when people come in, we do full diagnostics. Um, mouth to the other end. We check everything to see what's going on. That way we can treat it together. And I tell patients all the time when they say, why do I have to get this gut test? Why are we testing for molds, toxin, parasites, hormones? I say, because I'm going to fix your mouth. You're going to spend a lot of money for me to fix that. But if you don't get the rest of you healthy, and if you're not eating right, within 3 to 6 months, all that work you did is going to fail. And I don't want you to be frustrated, by not getting outcomes. So we got to fix the unit.
The mold toxicity, what's that test like?
So my provider here, she does cellular health testing. So there's many different things that you can do for mold testing. For her test, she takes a saliva swab, and then she also takes hair. She does a follicle test, and then that tests for all different things: molds, toxins, parasites, organ stressors, hormones, nutrient deficiencies, and food sensitivities, I think is what she scans for.
Mold, something we're hearing a lot about, and how that can be that big red flag that finally goes off and goes, "Oh, that's all my problems."
Yes. It's making people really, really sick. And it oftentimes will give you, again, subclinical symptoms, right? To where you don't get a diagnosis for anything, but you just know something is not right in your body. Oftentimes that's mold, it could be parasites, could be metal toxicity. That's what we're seeing, or even Lyme disease. We're uncovering a
A
lot of
lot
Lyme
of
disease. Yeah, we're getting a
I've
lot.
been here, and a lot of people who are going to a good functional dentist, biological dentist like you, and it comes back with both mold and Lyme.
We're getting a lot of that. We had a patient, one of my first patients here, she came in saying that she was diagnosed with Parkinson's. And this is what she did when she told me she had Parkinson's,
Air quotes.
meaning she had tremors, but she didn't have any of the markers for Parkinson's, and she wasn't getting any better or any worse. And so she said her doctor said she was kind of an enigma, but they diagnosed her with Parkinson's. And so we did all of her oral microbiome stuff, our inflammatory marker testing, and she actually looked pretty darn good. She did have a couple bacteria in her mouth that directly impact neurological function, so we treated that. But what we found out was she ended up having severe sleep apnea, which no one had ever done a sleep test on her. Sleep apnea directly affects your brain. Um, and then she also had Lyme disease that no one had ever found. And so we treated all that, and she significantly improved her symptoms. We didn't get rid of everything. She's had her symptoms for decades, but she's so much better than what she was when she came in.
Is Lyme one of those things, if you have it early on and they treat it, it goes away, or can it come back, or what's the situation there?
So I'm not a Lyme disease clinician. I have
Disclaimer.
Yes, I have a family member that has Lyme, and so we've kinda gone on this roller coaster with Lyme disease. And my understanding of it is when you have it, most of the time they give you antibiotics, and kinda kills the acute infection. But what I understand is that it really integrates into your DNA, and can hide and evade future testing. It can lay dormant for years and then kind of manifest itself in the brain. We see a lot of that in the brain, like as in my patient. So some people have neurological symptoms that are really unexplainable. And then it can also manifest like in joints. My family member who had it had such severe joint pain, was rendered immobile for months, really nauseous, couldn't eat, severe headaches, but all the tests come back negative, if you do a Western blood test for it. So,
Interesting. All right, so we talked about the fertility aspect of it. Let's go to women in middle age and
yes.
perimenopause, menopause, and symptoms, and all that, and how it relates, and what we should be asking for our mouths.
Yeah. So I would still, I tell everyone always get a microbiome test, because when you have a microbiome dysbiosis in the mouth, the bacteria themselves can affect certain systemic conditions, but they also cause inflammation in the mouth and the rest of the body. So when the microbiome is out of balance, it breaks down the gum tissue. And so that's when the gums start to bleed. And a lot of people have bleeding gums, or they say they only bleed occasionally. If there's any bleeding whatsoever, and sometimes when there's not bleeding, actually, the gums are still being broken down, which means the bacteria in the mouth are getting into the bloodstream and then circulating elsewhere in the body. And the body knows that those bacteria should not be there. So it starts eliciting this chronic inflammatory response. And that inflammation, especially for women, is really dangerous and impacts our hormones. So when we're going through perimenopause, it's really important that as our body is trying to figure out the new balance of hormones, or even if we're doing hormone replacement, to keep our chronic inflammatory levels down as much as possible. The other thing is we really want to make sure that in perimenopause, we're not losing bone. It's really critical that we keep our bone density up. And periodontal disease is one of those things that can, or that causes bone loss in the mouth. So we want to make sure that that's not happening. But other things that I hear from women, especially, is that they start to develop dry mouth. That's a really big one. They can get dry mouth. Their mucous membranes will dry up. And that's really dangerous because that shifts the pH of the mouth. It makes the mouth more acidic. It also changes the microbiome. So we know that someone who has a seemingly healthy microbiome, just from getting dry mouth, can now develop cavities and gum disease pretty quickly just from reduction in saliva. So it's really important to work with your dentist and your healthcare provider to make sure you're getting enough saliva in your mouth.
Hey, quick break. If you want more, I want you to join The Reset. It's our channel membership on YouTube. You get members-only bonus content, live chats, and updates that you won't see anywhere else. And if you choose a higher level, you unlock things like early access, members-only videos and streams, and more direct connection with us. Go to our YouTube channel and tap join and cancel anytime. So what do you do for dry mouth in middle age?
Yeah. For me, what I really like to do is I recommend hormone replacement therapy. I love bioidentical hormones. I think that we should try and stay, young and optimized forever.
Amen.
Estrogen. Okay, good. I'm glad you agree with
Oh,
that.
I am 100% on the bioidentical HRT. In fact,
Yes.
let's see, we're recording this on September 24th. I am 47 years old. And I started a week and a half ago. And I
Okay.
had just been waiting. My background is my mother died very young of Alzheimer's.
Mm,
And so my number one concern for myself, because I'm an APOE4 carrier,
okay.
is cognition
Yep.
and cognitive health. And all of the research I've read, everything points towards the earlier you can start, when it's time for your body, but the earlier you can start is more protective of your brain as you age. So
100%.
I'm like, periods are skipping. I'm starting to have a hard time sleeping. I had the frozen shoulder. It's funny you say dry mouth. I'm like, oh my goodness, I've had a little bit of that. Sex is not fun. Um, a little bit of hotness at night. And so I've been kind of waiting it out for the last year. And I'm like, no, it's time.
Yeah. Good for you. Yeah, so estrogen, right, is what we want. Estrogen's protective of our brain. It's protective of our bones to make sure we're not losing our bones. And that's what's really going to help lubricate the mouth and also help with sex as well. So estrogen, you can do it with your pellets with the testosterone too. I've been doing HRT since I was like 36, 37. Yeah. I was like, as soon as I started having any symptoms, I'm like, nope, let's get this balanced. Um, Speaking about the ApoE4 and cognition stuff, so PG, Porphyromonas gingivalis, and Fusobacterium nucleatum are the number 2 cause of Alzheimer's and dementia. Major link between those 2 bacteria, and Alzheimer's dementia. So check your saliva too.
So that comes out in the saliva test. My goodness.
Yeah,
Why does nobody say this? Thank
it's
you for
crazy.
being here.
Yeah. But that's really, really important. We test all of our neuro patients or people who are concerned about cognitive function for that.
Yeah.
But another really big one that I see in postmenopausal women, oral condition, is sleep apnea. So sleep apnea used to be thought that it occurs in, obese men that have very big necks that snore like truckers. And actually, my very first patient that I ever treated for sleep apnea was a postmenopausal woman. She was probably 67, 70, something like that. Really thin, petite, very put together, always was dressed to the nines every time she came in. She had been my patient for a very long time. And then she came in one day and she just looked wrecked. Like, she looked like she'd been hit by a bus. And I said, what's going on? You don't look yourself today. And she said, I feel like I'm going to die. I feel like something is sitting on my chest. I have horrible heartburn. My breath smells. My anxiety is through the roof. I can't sleep. And I called my doctor and they can't get me in for 6 weeks. And I told them that I thought I was going to have a heart attack and they told me to go to the ER. And she's like, I don't know what to do. And I said, well, you don't really fit the bill for this, but all of your symptoms do remind me of a condition called sleep apnea. We should do a home sleep test to see if you have apnea. And sure enough, she did. She had severe sleep apnea. She was, so we measure how many times a person stops breathing per hour for 10 seconds or more, or their pulse ox drops by 2%. She was in the 50s. She was stopping breathing over 50 times an hour for 10 seconds or more, which is crazy. And we treated her for sleep apnea, and within 3 to 5 days, she's like back to normal. And so that really convinced me to start screening more for airway disordered breathing in my office. But I see this a lot in postmenopausal women because estrogen and progesterone are responsible for our muscle tone. So when our hormones drop and we're not replacing them, and as we age, we lose collagen, right? So everything starts to sag. Then we lose bones. Our muscles and skin and everything are attached to bones. So that starts to collapse. And then we lose our hormones, and now we don't have any muscle tone. So my number one patient that I treat in my practice for sleep apnea is postmenopausal women, thin postmenopausal women. Yeah.
Thin postmenopausal women.
Yeah, I do want to shout that out because sleep apnea is fatal if it's untreated. It's only a matter of time. And most people never look at postmenopausal women, especially thin ones, for apnea. And yet,
So can it be developed, or has she always had it and we just figured it out?
so couple things. Yes, it can develop over time. So airway only gets worse as we age. Oh, yeah, like everything, right? Because things aren't as tight anymore. We lose our collagen, we lose our muscle tone. So things just start to collapse as we age. So yes, you can develop it. The other thing is that anatomically, people can be born with a small airway. I don't know if you've heard of Weston Price and that whole group. So, you know, it's very evident that our bone structure and our jaw structures are shrinking over time, right? And most people these days, I think, have a compromised or restricted airway to begin with. And so when we do our 3D CBCT scan, we'll actually measure a patient's airway anatomically to see if they're at high risk for sleep apnea. And then if they are, we always do a sleep test. And so you could be born with an anatomic restricted airway, which puts you at a higher risk for apnea. But then as you age, it absolutely gets worse. So even if I test someone right now and let's say they're 45 and they're, maybe they stop breathing 2 times an hour, which 5 is kind of the cutoff for mild sleep apnea, I may recommend to retest in 2 years because it is only going to get worse.
We'll be right back. Don't go away. It's just getting good. This episode of StRest is sponsored by Revitalign. I love these shoes. I have loved them for almost a decade. And here's the reason why. The rest of your body is not going to be happy or healthy if you don't have the right footwear. You need that support. This has a full contact comfort footbed in every single pair of shoes. They're well known for that metatarsal dome that really gives you support and the right alignment so that you can take those extra steps. You can chase after those kids or those dreams or those goals or just chase hard after Jesus. I love a great new pair of shoes. There's something about that box coming to you. You get it to your house. You get excited by the outside. You open it. You see those new shoes. I just can't get enough of it. And the best ones to get are from Revitalign. Go to their website, wacoshoecompany.com. That's Waco, W-A-C-O, shoecompany.com, and use the code Kerstin20 for 20% off site-wide. And here's another pro tip. Go to QVC's website and search Revitalign. Look at all of the amazing styles and usually at a fraction of the price that they have there at QVC.com. Either way you shop, make sure you get your new shoes from Revitalign.
1, 2, 3. Wow. Boom.
And tell me again, red flags or symptoms that you may have sleep apnea and you should get tested, other than the obvious, which is like, oh, my partner says I'm snoring.
Yes. So these are, and thank you for asking this because this is really important. If you clench or grind your teeth, you should absolutely get a sleep test before ever getting a night guard. I made this mistake, and 95% of dentists, when we see someone who clenches and grinds, we hand them a night guard Clenching and grinding is the first symptom that you have sleep apnea. So you shouldn't get a night guard because night guards are going to make sleep apnea worse. So clench and grind your teeth, sleep test. Acid reflux is a big one. So if you have acid reflux, then you should get a sleep test. Others are if you have to wake up frequently to urinate in the middle of the night, which I hear this from postmenopausal women a lot, 3 or 4 times to pee. That's usually sleep apnea while you're getting up because you wake up because you're not breathing and then your brain stops the ADH hormone and now you have to go to the bathroom. So what precipitated that wake up was not breathing. If you're on 2 or more blood pressure medications, that's apnea. If you have diabetes, there's an 85% chance that you have sleep apnea. What else is there? High blood pressure, GERD.
I'm writing all of these down. I'm taking notes.
Yeah. Oh, AFib. That's like 100%, almost 100% correlation with apnea.
Get a sleep test. But what I hear from people is, okay, but I'm not going to get a sleep test because I'm not going to wear that CPAP machine.
Yes. So, and I don't want you to because CPAPs are ridden with mold most of the time. So they're not good. They also are blowing so much air in your face, like it's positive pressure, right? So it's trying to blow open your airway. And all that air coming in is drying things out and it messes with your microbiome. So I don't want you to wear a CPAP either. We have really good treatments now for sleep apnea. We can do an oral appliance. So it's like upper and lower retainer that holds your jaw in position. That way your airway doesn't collapse. We can also do laser where we go in and we can laser the back of the throat. You don't even need anesthetic for this. There's no downtime. It just tightens the muscles in the back of the throat and changes the type of collagen back there. So it kind of lifts the airway, the soft tissue in the back of the throat up to open up the airway. And then for mild cases, I always recommend and for almost anyone, I always recommend myofunctional therapy, which is essentially physical therapy for the muscles of the mouth. Because as we age, we're losing our muscle mass. And so we need to retone and tighten things back up so that way we can breathe.
This is all such great information because I think a lot of women are very nervous about even getting the test because they don't want to know what they have to do.
CPAPs aren't sexy, but like when you think about brain cognition, right? Like women, we lose our brains as we age, or we have a history of doing that. And so the 3 critical things for that is, making sure your microbiome is good, making sure your airway is good, and then making sure your hormone levels are balanced. That's how you keep your brain.
So, as somebody who's very functional, very integrative, as a doctor, what do you personally do? What are your non-negotiables for your health, for your wellness?
Sleep. I will not negotiate on that. You can ask my husband. We have a 2-year-old, so he takes night duty most of the time. Because I will not compromise on my sleep. I'm the early morning person, right? Like
Me too.
I can sleep till 4, I'll get up and handle everything else. But let me sleep from 9 to 4, at least. So sleep is going to be critical. Supplements. I'm a big supplement person because I will admit, shamefully, that I'm probably not getting the complete nutrients that I need from my food. I'm so busy that, I eat when I can and I'm probably not getting everything. So I'm a big supplement person.
What are your favorites? Like top couple
Oh gosh.
favorites.
Well, I have an IV clinic in my office. So
Oh, God bless
I
you.
know
I
I
love
I'm
IVs.
cheating. So I get it's called a detox IV every week. So it's glutathione, alpha lipoic acid, and vitamin C. I also do NAD plus for my brain because I had a brain injury, obviously. So I do a ton of NAD plus for energy, mental clarity.
What do you use glutathione for? What's your pitch for glutathione?
Detox for sure. Dentistry is a very toxic profession. My thyroid died a year after I began practicing. Out of the blue, thyroid issues don't happen in my family, and it's because I was taking out mercury fillings unsafely. And I still continued to do that for years afterwards because you're not taught any different in school. And mercury will outbind iron to the thyroid every time. So, and then we have plastics and everything else that we're dealing with. And so I love glutathione. I love to detox all the time. Plus, I think our environment's just so toxic.
It's so toxic.
So toxic. And I know I'm not perfect with everything, right? You got to manage what you can, but I don't want to drive myself crazy about it. So I just throw an IV.
And that's a good message that I hope everybody I try to say it all the time. You get so much information on the internet, in this podcast, everywhere. And you're like, well, oh my God, goodness, how do I do all of these things and manage all these things? It's a balance. You just do what you can, especially the toxins piece of that. Like if you can try and just swap out some of your skincare or swap out some of your cleaning supplies or open the windows every single day for a few hours to air out your house. There's going to be other times when you're going to have heavy toxins as a result of something. I mean, honestly, we as women often decide to go get Botox. You know, like, so there's a balance.
If you switch that to Xeomin, that's another good hack. So Xeomin is a bit healthier than Botox. You can do lasers too. Some docs will do lasers now, so that's good. And then supplements D3 and K2, especially for women. Must take D or K2 with your D3. I do that. Magnesium is another must. I have to do my magnesium complex, and I have to do my methyl guard because I have the methyl mutation, MTHFR mutation. So I do my methyl guard.
And
And
is
then
that methyl blue?
no. It's just called methyl guard by Thorne. Um, it's just my vitamin Bs, but they're methylated since I have
Okay.
HFR. And then the other one that I do that I love that I'm addicted to right now is cortisol relief. Oh my gosh, obsessed. My functional provider told me about it because my adrenals were shot and they've always been shot. I think I've been in fight or flight since my accident, to be honest.
I would assume something traumatic like that. Yeah.
I've tried to do acupuncture. I've tried to do all the things to get out of it and like I just can't. And so she recommended cortisol relief. You can get it online. It's kind of expensive. It's like $50. But oh my, I wear, trackables. I'm always tracking and my heart rate variability has always been really low. And I'm like, I'm going to die in 10 years because my heart rate variability is so low. Overnight, it doubled. And that's the only thing I changed. So cortisol relief has been huge for me.
Yeah, I'm buying that tomorrow because we sound a
I
little bit.
tell everybody, all my patients, I'm like, even if you're not stressed, you should take cortisol relief.
We kind of sound similar on the same thing. Like that HRV is one of my
Yes.
Which
Yeah.
one do you wear? Which
I have the
tracker?
Whoop.
Yeah. So I do the Whoop. Actually, I'm charging right now,
Yeah.
and I'm doing the Aura at the same time.
I
And
kind of want to try the Aura. I've had the Root for years. But yeah.
But
Um,
I will tell you, Aura says that my HRV is dramatically lower than my Whoop does, and that
Whoa.
makes me insane.
Don't tell me that. I've been trying to, they say breath work helps with your HRV, right? Cardiovascular stuff, which are all things I do, and I've never been able to get it up except for cortisol relief.
What's one thing that you think everybody should take away from this that they can do right now to help relieve some of the negative toxic stress in their lives?
To relieve toxic stress in their lives.
Well, just in general, because we know stress impacts their health. And I
Yeah.
would say first and foremost, it's get the saliva test.
I mean, get a saliva test because the like I said, majority of all diseases are caused by inflammation. 7 out of the 8 leading causes of death in America are caused by inflammation. The only one that's not being car accidents. We looked at all of the things that cause inflammation, and at least half of them originate from the mouth. And so the mouth is one of the most underappreciated or underlooked areas of the body that can be causing a lot of people's systemic issues. And it's one of the easiest to fix. So please get it fixed. If you have mercury fillings, please remove them. Get your root canals checked, get your microbiome looked at. Because these are all easy things that you can control. A lot of things you can't control in our environment. And so, try and focus on things you can impact.
Absolutely. Where can people find you?
They can find me on Instagram at Katie Lee DDS. That's dentist, surgeon. Or go to katieleedds.com.
It's fantastic. Thank you so much for your insight. It's been wonderful. It was so nice to meet you.
You're welcome.
Coming up on the next episode of StRest, we have in Maria McCool. She is the creator of Callista. You've probably seen that line of hair care products on QVC. She's also been my hairstylist for the last 15 years. And before you giggle like I just did, wait, Kirsten's having her hairstylist on. The person who does your hair probably knows more about you than anybody else. What is that? What is that connection? Why do we bare our souls to the person who does our hair? Well, there's real science behind why you do that. It has given Maria insight and specifically into women in middle age as to what makes us feel beautiful and brave and confident. We talk a lot about purpose, and we also give you some of the things that you need to know about your hair if you are in middle age. All of this is coming up on the next episode of StRest with Maria McCool.
If you're enjoying the show, don't forget to subscribe and leave a review on your favorite podcast platform. Your reviews help others find the podcast and join our community. Follow me on social media at Kerstin.Lindquist for daily tips and inspiration. And visit my website at www.Kerstin-Lindquist.com to sign up for our newsletter and receive exclusive content. The information provided in this podcast is for informational and educational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The host of this podcast is a certified health coach and medical researcher, not a licensed medical professional, and the content shared does not constitute medical advice. While we strive to provide accurate and up-to-date information, we encourage you to do your own research and consult with your healthcare provider before making any changes to your healthcare treatment plans. Thank you for joining me on this journey to reduce stress and make room for rest. Remember, you're not alone. Keep coming back, share your story, ask for help, and give yourself grace.